Why do many of us believes that severe form of malaria is a leading causes of neonatal jaundice? What is this lie about? How come we believe so much that it is only when a baby is bitten by a mosquito the baby comes up with a neonatal jaundice? They never talk about how a baby breastfeed from the mother's milk and come up with a neonatal jaundice. They never talk about how the mother herself passes on this neonatal jaundice from herself to the baby. They never talk about how a mother is not well clean and passes on this neonatal jaundice from herself to the baby. Then how come we believe that a baby of 0 to 2 days or 3 days come up with a neonatal jaundice and we are told that it is a severe form of malaria? For the purpose of this video, I am going to tell you the real causes, the actual causes of this neonatal jaundice, so that we stop believing these lies, we stop believing these fallacies about neonatal jaundice. To be forewarned is to be forearmed. Have these four major causes of neonatal jaundice in your head or in your tip, so that when next you are being lied to, you will know where to hold on how to get about the treatment. A quick one, guys. Let's talk about neonatal jaundice. What do we mean by neonatal jaundice? When it comes to neonatal jaundice, these are two compound words, or these are two words that are being joined together. Neonatal and what? And jaundice. Neonatal means a neonate. Who is a neonate? A neonate is a baby of 0 days to 30 days. That is a neonate. A newly delivered baby, either through CS or through normal delivery. That is called a neonate. That the age is still between the 0 day or the 1 day towards to the 30th day after delivery. That is a neonate. Then, when it comes to jaundice, what do we mean by jaundice? What is the medical term? How do they come about jaundice? Jaundice in short form, it is a yellowish what? Discoloration. Yellowish discoloration you found on the skin or in the eye. That is what we call jaundice. This jaundice, it occurs as a result of what? Excessive bilirubin pileup. Excessive bilirubin build up in the blood vessels or in the bloodstream, which absorbs back into the bloodstream. In neonatal jaundice, a lot of us have been worried about that. What are the causes of this neonatal jaundice? That most of the time when they give birth to baby, you see their eyes, it become yellowish. It become yellow. It has what? A yellowish discoloration. What are the causes? To surprise many of us, we don't know the causes. But most of us will also think that severe form of malaria is a leading cause of a neonatal jaundice. But that is a big fallacy, because how can a baby of 0 to 30 days of age be bitten by a mosquito that could cause a severe malaria? Because you have neonatal jaundice to occur even second day or third day after delivery. So how is it possible that it is a severe form of malaria that leads to this baby's neonatal jaundice? This is something that we should talk about. If you are just coming across our video for the very first time, do well by subscribing to my channel. You are welcome to my channel. Like, comment your experiences about neonatal jaundice. What have you experienced as regarding that, as a health professional, or as a mother, or as a father who has given birth before, or as a person who have heard of neonatal jaundice? What are the causes of neonatal jaundice? Because severe form of malaria is not the cause. Then what are then the cause? Number one cause is physiological jaundice. Now, in this physiological jaundice, why do we call it physiological jaundice? It is also called a normal jaundice. Clearly, jaundice is a problem, but in this case, we also refer it to as a normal jaundice. How is it referred to as a normal jaundice? In physiological jaundice, it occurs naturally, it occurs on its own. But in this type of jaundice, it is not usually severe because they disappear after 3 days that they occur, or after 5 to 7 days after they appear on the skin or on the eye. That is why it is called a physiological jaundice. And it's also called that because during after delivery, the baby's liver is not yet matured. Baby's liver is not yet matured, and it is this liver, the end product of the liver is the bile, and this bile are the one that accumulates in the bloodstream that leads to that discoloration. So due to the immature or premature liver, it produces a lot of bile which cannot be metabolized out of the body. So this bile buildup is the one that leads to this yellowish discoloration. So by the time the liver builds up with breast milk and all of that, and as the baby grow, you see the jaundice, it clears off or it's clearing away. That is one of the causes of neonatal jaundice. Then the second cause for the purpose of this video is breast milk jaundice. Breast milk jaundice. What do we mean by that? Breast milk jaundice. Breast milk jaundice is also, you can also call it as breast milk jaundice instead of milk. Yes, there are some baby that they take or they are being breastfed with a breast milk and they still become jaundice because of that, what? Because of the breast. What is it? Is it that you are not supposed to feed your baby with a breast milk after delivery? No. In breast milk jaundice, it occurs as a result of a substances. There is a toxic substances that is present in that milk that the baby is sucking or the baby is benefiting from. So the presence of that substance in that breast milk has the ability not to break down excessive bile in the baby. So immediately when the baby takes in the breast milk and it gets to the liver, it increases the rate of bile production without even metabolizing it to be excreted out of the body or to be used up by the body. So these substances are the one that present in the breast milk. They are the one that causes the excessive production of this bile or decrease metabolism of this bile in this baby's in this baby's liver, which leads to its accumulation of bilirubin in the bloodstream, leading to that yellowish discoloration. That is a breast milk jaundice. Then this will also take us to a breastfeeding jaundice. Number three causes of jaundice: breastfeeding jaundice. This is different from breast milk jaundice. In breastfeeding jaundice, it is related to what? Breastfeeding. Now, in this case, how does breastfeeding jaundice differentiate or differs from a breast milk jaundice? In breastfeeding jaundice, it occurs as a result of breastfeeding processes. It's either from the maternal side or from the baby side. Now, let's talk about the baby side. In the baby side, it is because of the sucking reflexes. The baby has not gotten a full control of the sucking reflexes, which is bad. So, for baby who has not fully developed their sucking reflexes to suck enough breast from their maternal, due to the baby not to get enough breast, it leads to that breastfeeding jaundice, and it comes back until when the baby can fully suck well before the breastfeeding jaundice disappears. Then, if reparting to the maternal side, it occurs as a result of the mother's breast not producing enough milk. There are some parents or there are some mothers that give birth after some days, 3 to 5 days. They find it hard, very hard, or very difficult for their breast milk to come up. So, in absence of breast milk, when the baby is supposed to be breastfed with a breast milk, the baby come up with jaundice because of that maternal problem of not producing enough milk for the baby to be breastfed with. That is number three causes of neonatal jaundice, which is called breastfeeding jaundice. And this takes us to the last causes that might also cause this neonatal jaundice. We have sepsis. Sepsis can come and it results to this neonatal jaundice. How does sepsis comes? Maybe through the use of poor or unsterilized objects during delivery or during cesarean section, as it may happen, or poor care of umbilical cord. So after you cut the umbilical cord of the baby, if there is a poor cleaning or poor care, you wear the diaper of the baby over the umbilical cord without cleaning it. It heats it up, it sets up an infection that it breaks down the red blood cells in the body. So aside sepsis, there are so many other causes, so many other risk factors that can lead to this neonatal jaundice. Premature babies, it results to neonatal jaundice. We also have blood group incompatibility between the maternal and the child. It can also cause neonatal jaundice. So there are so many causes that many of us don't know. But it's so surprising when you ask that what causes neonatal jaundice, and most of us will come up with what? Severe form of malaria. But no, it is not. So if you are just coming across our video, comment your experiences about neonatal jaundice. How were you able to manage it? What are the signs and symptoms you see during that process, and how were you able to cope with it? Till we meet in our next video, because in our next video I am going to enlighten you on how do you treat, on how do you what? How do you treat, or how do you manage a baby with neonatal jaundice? Because most of us, what we know is putting our baby on the sun, but it is not the treatment for neonatal jaundice. Till we meet again in our next video, don't forget to subscribe, like, and share our video for more tips like this for your health, or overall health and reproductive health. Thank you.